Hello, I'm Dr. Jeffrey DeSarbo. I'm a psychiatrist and the medical director of ED-180 treatment programs in Long Island, New York. I'm here today to talk to you about the Body Image Surveillance Scale, or BISS. It's a screening tool I created for ED-180 and the clinicians that I work with. It's for monitoring patient body image perception, distress, and their coping of that perception and distress. It's an easy tool to use, but I think you can find it very helpful in your treatment process. This is what the scale looks like. There's three facets to it: perception, distress, and coping. Perception is how one basically sees and views themselves when they look at themselves in a mirror and how they feel in their skin. Perception is always like one of the most difficult things to treat because it's very biologically related in how distortions and patterns of how someone may see themselves and perceive themselves can be affected by an eating disorder. So there's sometimes can take a couple years to get significant movement and changes in perception. The distress is the emotional fallout for how one is perceiving themselves. They may be crying all the time. They may have very low self-esteem and self-confidence in social situations. They may feel that they just can't let anyone see them. They're constantly being judged because of how they look. And sometimes that level of distress becomes serious with self-harm and thoughts of not wanting to live anymore. So we then look at the third facet of coping. How does one deal? How do they cope with that perception and distress? For some, not very well. For others, they may be kind of more accepting of those levels, tolerating it, which might allow them to do better work and proceed in their treatment and recovery process, while others may be engaging in significant behaviors that are often related with an eating disorder: binging, purging, restricting, diet pills, exercise. And sometimes with coping, they can't cope with body image. They may be thinking about plastic surgery or liposuction, taking drastic measures to get there. So there's three basic questions that go with the BISS scale. The first is on a scale, it's the perceptions question. On a scale of 0 to 10, 0 being you're very happy with your body image and 10 being you hate your body image, how would you rate your image today if you looked in the mirror? And with eating disorders, again, we're always going to see high numbers usually. We're going to see 7s, 8s, 9s, 10s, and sometimes people want to answer that question with a 12 or a 20. So perception is one of the key facets, because that will often highly affect question number 2, which is their levels of distress that go along with it. Question 2 is on a scale of 0 to 10, 0 being you have no mental distress with your body image, and 10 being you find it difficult living with your body image. How would you rate your level of mental distress related to your body image? And like I said, the level of distress is often related to how they perceive themselves. And some people are distressed, they're crying, they're sad, they're anxious, they're irritable, they're avoidant. And sometimes, again, we worry about that it's so distressful that they don't even feel like living anymore. Then we want to look at question number 3, their coping question. On a scale of 0 to 10, 0 being you have no difficulty coping with how you feel about your body image, and 10 being you feel driven to do things drastically to change your body, how would you rate your feelings of needing to change your body? Coping is probably the one area that when someone is in treatment, it's a key factor that you want to kind of work on first, is coping with that distress, that emotional component, coping with how they perceive themselves, because the perception is going to probably take the longest to start to improve. The distress, which is tied into that, will be highly related to it, but if you learn coping mechanisms to deal with that distress, people will stop engaging in more behaviors like restriction or purging or using diet pills, laxatives. But again, when people say their coping is not going well and they're thinking about that plastic surgery and they're doing drastic measures, they're going to have high scores on that coping question. So this is just might be something if we have somebody without an eating disorder who says, yeah, Perceptual, I'm not happy with what I see, but you know, it's not killing me. I can live with myself. I probably could be more fit than I am. I'm not in a lot of distress. It doesn't interfere with my day-to-day life. Maybe, and coping is I'm living with myself. I might not even be dieting or exercising. I just accept my body for what it is. But you know, it's not what defines me. They may have scores that fall into what we call more of a healthy acceptance range, a 4. Then you can have an individual who's struggling with their perception of themselves. They may not be that they hate themselves and just want to, end it all, but they may have scores, let's say, of 6 in the level of perception and distress, but they're coping with it. So their overall BISS score would be a 15, which puts them kind of in a moderate range. It's working with people in this range. Often you can put together a treatment program, compliance is going to be high, but I just want to show you if we slightly change and that patient then reports their ability to cope with that level of 6s in perception and distress, their coping goes up to an 8, it's putting them more now in the range of serious, okay? That makes treatment a lot more difficult at times. So we want to work on helping people cope with perception and distress while monitoring those 2 factors. Of course, with an eating disorder, we're often seeing these very high numbers. Again, the 8, 9s, and 10s with perceptions. The levels of distress sometimes can be higher than the perception itself. So if they're struggling with coping, engaging in a lot of eating disorder behaviors, compensatory mechanisms when they eat or severely restricting, then they're reaching that level of severe to extreme. And this is where it can be very difficult to treat a patient because their minds are basically in a constant level of distress. And they're following through on their actions and behaviors, thinking they're going to alleviate it, which often just furthers to complicate their levels of distress. So we want to be very cautious when we're working with people who are in that severe to extreme level, because we probably need to see, is treatment able to kind of proceed forward? Is there good compliance with treatment even though there are these high levels? Because compliance is highly affected as the BISS score increases. Or do we need to think about another intervention or level of care? Of course, if you can work on the coping here and bring that level down, even if they maintain that high level of perception, dissatisfaction, and high levels of distress, but we're able to help treat people and help them cope better with those high levels, then we're bringing it out of the extreme area. It can still be serious, but we're bringing it down to extreme, and when people can cope, that's where we're going to see people be able to actually follow through with the treatment plan, to be compliant with their treatment plan. They're not happy about how they feel about themselves, but they're able to do the work because they can cope with it. So here's just a level of the scoring of the BISS scale, 0 to 5. Like I said, it's a relatively healthy attitude about body image. And then we start getting to levels of concern, mild concern, moderate concern, as the numbers start to go up in these ranges. When a BISS score starts to get above 15, now we're looking at, and that's usually in acute phases of most eating disorders. And usually when people are going into higher levels of care, their BISS scale score is going to be above 15, usually. And so we become more concerned both for how they can handle the treatment and be compliant with it, but also for their safety and well-being. And so we want to make sure there's no self-harm or desperation of suicidal thoughts or anything like that going on. Of course, that level above 25 is in the extreme area of concern. So that's where patients have to be monitored closely. This is how you would kind of chart a BISS score. You could put the total score. For instance, if you have a patient and their score is 21, I recommend you break it down. Here in the parentheses, you'll see perception 8, distress 7, coping 6. This way, from note to note, as you follow it, you can see how their total score progresses, as well as the breakdown of those 3 facets. And if you use the forms, which you can download, I'll give you that information in 1 second. You can usually track, let's say you want to do a monthly monitoring using a BISS scale. Here you got January, February, March with different reported scores from the patients. You can see the scores go from 25 to 22 to 20, often moving people from, that severe extreme down to still the serious. But like I said, one of the things sometimes if you find your patients doing well in treatment and all of a sudden there's a major setback and there's a significant increase in patterns of behaviors, you'll often see major changes, usually in the coping category, but you look at the other levels too, because you will see changes in how they perceive themselves and the levels of distress. But that coping can be a key factor that you monitor, especially when needing to come up with some immediate interventions. So if you'd like to get an actual printout copy, which you can keep in charts, like I said, I created this, but look, people can use this for their treatment. In a clinical practice, clinicians use this. Treatment centers can download the PDF file and keep track of it, or you can just chart it in your notes if you want. But if you want to get an actual hard copy, I can send you a PDF copy of this form right here. It makes it very simple to use. All the questions are on it. You can make as many copies as you want to. Just send me an email to drdesarbo@gmail.com and I'll email you back this PDF file. So I hope you find this helpful. I think it can be a tool that helps treatment in a significant way. It can be very productive in how one person comes up with a treatment plan. And also for the patients, I think it can also give them great insight. So again, I hope everyone likes this form, wants to use this. Just ask me for it and I'll send it to you. Again, my name is Dr. Jeffrey DeSarbo. Thank you for listening. Talk to you soon.